My name is Bradley Lafortune. I work as the executive director of an organization called Public Interest Alberta. Here to talk about housing and public health today. It was really nice to hear the report from AHS and the Chief Medical Officer of Health for Edmonton, which really underlines that housing is healthcare. Housing is always a foundational issue, but right now, whether it's affordability, adequacy, accessibility, habitability, or lack of wraparound supports and services, and also shifting focus, quite frankly, to enforcement instead of upstream solutions when it comes to community well-being. We are in a true emergency. There are a few foundations that work, that if we follow, that they can provide an opportunity for Edmonton to address the crisis in houselessness, which will ease the burden that we're hearing about today on our healthcare system. But we need the province at the table in a meaningful way. To me, it's very clear that our current efforts at finding an adequate partner in the province are simply not working. I'm really, really concerned that our current provincial government would like to make the cynical case that Edmonton is San Francisco of the North, at least the version of that city that exists in the minds of conservative and Republican activists. However, we know the major causes for deepening homelessness are not due to proven policies and programs that work when they go hand in hand and they're adequately invested in, but quite the opposite, a lack of those supports and services. So we need to advocate to the province that the stronger foundation needs to be thrown out the window. We need minimum shelter standards, as we heard today. We need a massive reinvestment in permanent supportive housing and near market housing. We need investments in wraparound supports and services so that those supports and services can walk alongside individuals when they're being housed and rehoused, so that we don't see a failure of housing first policies.